Assalamualaikum and hello everyone. Today we will be talking about infertility in Malaysia, a condition that affects many couples yet often goes unspoken. We will also explore how modern medicine, especially in vitro fertilization or IVF, brings hope to those who dream of becoming parents. So, what is infertility? Infertility is defined as the failure to achieve a pregnancy after 12 months or more of regular, unprotected sexual intercourse. It can be caused by male factors, female factors, or unexplained reason. In Malaysia, approximately 10 to 15% of couples are affected by infertility.
Next, we're going to talk about the causes of infertility. For men, infertility may be due to first, abnormal sperm function or low sperm count. Second, blockage in the reproductive tract. And lastly, lifestyle factors like smoking, excessive alcohol intake, and obesity. Next, for women, the common causes include first, blocked fallopian tubes known as tubal disorders. Second, uterine disorders such as endometriosis. Lastly, hormonal issues like polycystic ovarian syndrome or PCOS. What is IVF? So, as we know, one of the most effective treatments for infertility is in vitro fertilization or IVF. IVF involves fertilizing an egg with sperm outside the woman's body in a laboratory. The fertilized egg, now called an embryo, is then transferred back into the woman's uterus to initiate pregnancy.
Now, let's look at the IVF process in 9 simple steps. First, ovarian stimulation. Fertility medications are used to help the ovaries produce multiple eggs. 2. Monitoring and trigger injection. Ultrasounds and hormone tests monitor the egg growth. A trigger shot is given when the eggs are mature. 3. Egg retrieval. The eggs are collected from the ovaries using a fine needle under light sedation. 4. Sperm collection. A semen sample is collected and prepared. 5. Fertilization. The eggs are fertilized using either conventional IVF or ICSI, where one sperm is injected directly into each egg. 6. Embryo culture. The embryos are grown in the lab for 3 to 5 days. 7. Embryo transfer. One or more embryos are transferred into the uterus. 8. Luteal phase support. Hormones are given to support implantation. Last, pregnancy test. After 2 weeks, a blood test is done to confirm pregnancy.
Do you know that Islam encourages seeking help through permissible means while trusting in Allah's will? IVF is allowed in Islam as long as it involves a married couple and does not include third-party donors. Although there is no specific Quranic verse that directly mentions medical treatments like IVF, but the Quran does highlight the power of Allah to grant children to the infertile and encourages seeking help through prayer and effort. We can refer to verse 42, number 49 in Surah Ash-Shura below. The Quran reminds us that Allah grants children to whom He wills and in His perfect timing. In conclusion, hormones play a very important role in controlling many functions in the human body, especially reproduction. When there is a hormonal imbalance, it can lead to infertility in both men and women. In Malaysia, many couples are affected by infertility, which can be emotionally and physically challenging. Thankfully, medical treatments like in vitro fertilization (IVF) offer new hope for those who are struggling to have children. It is important for us to understand how hormones work and to be more aware and supportive of those going through infertility so we can build a more informed and caring society. Let's continue to raise awareness, support one another, and promote a compassionate society. That's all from us. Thank you so much for listening.